Discharged into dangerous heat. Over the last 3 months, we found 10 cases of people who were released from the hospital who ended up on the bus stop out front. What are hospitals supposed to do when they release someone who has nowhere to go? That's on this edition of the Arizona's Family Investigates podcast.
Taking you behind the investigation, this is the Arizona's Family Investigates podcast.
Thanks for joining us for this edition of the podcast. I'm Amy Cutler, joined by senior investigative producer Cody Lillich. We started looking into this back in June following a tip that we received.
Yeah, someone reached out to our tip line, which anybody can email us on, and reached out to our team saying he works across the street and saw that a man who died at the bus stop outside Banner University Medical Center in Phoenix, one of our largest hospitals here in the city. They claim the man had been out there for hours back on July 2nd, a very hot day here in Phoenix, and that it was clear he had come from the hospital. The person wrote, "This should not happen in our city."
And it was just such a telling message. You know, you could tell in that email that he had clearly been moved by what he had seen right across the street from where he worked. Now, after vetting the tip, we sat down with the guy who had reached out. His name is Dennis Plunkett. It turned out he worked across the street from Banner. His office window faced that bus stop, and he explained this was not a one-off.
Our culture needs to do something. Our society needs to do something to figure this out, because that's not okay. You know, those are people's relatives. Everybody that we see is somebody loved that person and didn't have any idea what happened to him that morning.
So Plunkett was really moved by what he saw that morning and reached out to Phoenix police, and then the county medical examiner ended up responding. And we were able to identify who that man was that died that day. His name was Stuart William Fields. And you spent some time looking into just how he ended up there and how he died.
Yeah, so on the county website, we were able to determine through the medical examiner's office that he had died of natural causes. The listed condition was alcohol use disorder. But interestingly enough, heat was not listed as any kind of contributing factor. But we know from Plunkett that he had been out on that bus stop for several hours.
And it seems to be, you talk to the man who worked across the street, and he sees this often where, it's not hard to put two and two together to find out where people who linger at that bus stop, where they just came from.
Yeah, and I had really tried to track down some family or friends of this man who had passed, and it was difficult because he's got a fairly common name, so I wasn't able to find any obituary or anything like that, but Plunkett had pointed out that this was a human being who likely had family and friends who would miss him, and this is not something that should be happening in our city.
And so the initial call that brought police out there, was that the witness's call? And what brought police out there?
Yeah, so Phoenix police told me that it was a well-being check, that somebody driving by had seen this gentleman on the bus stop, laying out, and they had felt like, he wasn't moving and that they needed someone to come and check on him. Plunkett says that he sees people who appear to have come from the hospital. They're wearing hospital gowns, bracelets, and they're either wandering around out front or more likely at that bus stop. Now, we asked Plunkett to take photos of what he was seeing, and over the next 3 months, that's exactly what he did.
We wanted to make sure that this wasn't just a one-off, a tragic incident that had happened. We needed to establish that this was a pattern, and the photos he took were telling. They showed people in some of the hottest times of the day and of the year here in Phoenix outside on the street. So it's well into the triple digits, temperatures pushing 110, 115 at sometimes this year. And in one case, a man wasn't responsive and an ambulance had to be called, which was really telling because this is a location that was steps from the parking lot of the hospital. So an ambulance had to be called to take this individual who presumably had been seen in the hospital or the medical center at some point and had to respond to bring that person back to the hospital, which was just around the corner. So that was one of the more telling images that, kind of jumped out at me. But Plunkett says that hospitals need to do more to address this issue.
I feel that's inhumane. And I know that hospitals have social workers on staff, so I don't know what attempts they made with this gentleman. I don't obviously know anything about it. All I know is what I saw as an observer. And what I saw was not the solution.
And it's important to note that this is not just an issue with Banner. We also stopped by St. Joe's, also in Phoenix. We went to some businesses across the street from a bus stop out front there, and they told me that they frequently see people who clearly have no place to go, some of whom look like they have come from that hospital. So it's not just a Banner issue, but it begs the question, what are hospitals supposed to do in these situations when we've got this extreme heat and these people clearly have nowhere to go?
And that is a challenge for them to, complete their medical care. But then, so you've reached out to both hospital systems, being Banner Health and Dignity Health. Dignity Health owns St. Joseph's Hospital here in Phoenix, which is one of our largest trauma centers in the area. What did they tell you about this because the patient has finished their care. So as the hospital is releasing the patient, what do they do to ensure that they're not left on their own?
Yeah, so, it was sort of frustrating because they didn't want to do an interview on this. So they responded to my questions with statements, and the statements explained that they had social workers who they specifically had to work with people in the emergency room. And so they try to connect patients who don't have a place to go with resources. And then, they also said that before they release anyone, they receive a medical exam. So they're saying, hey, we do our due diligence. We're making sure that they are physically fit and, able to leave the hospital. They don't need any more medical attention at that time, and that they are connecting them with whatever resources are available in the community.
And so that's what those two hospitals do, but it made us wonder, what are they required to do? Is there anything set up governing these hospitals that tell them what they must do, not just what they are doing now, but what they must do? What did you find out there?
Yeah, so that's when I started trying to reach out to some attorneys, because I was wondering legally what's the bar here. And so we went to Tom Ryan, who's an attorney who specializes in healthcare law.
Hospitals are required to follow a federal law called EMTALA, and it's about providing emergency medical services and pregnancy services to people who enter the emergency room. It requires them to do a basic medical assessment. Why is this person here? What do they need? It requires the hospital to stabilize that patient, and they cannot discharge that patient until that patient is medically stable.
He was talking about there was the Emergency Medical Treatment and Labor Act. It's something that dates back to 1986, requires hospitals to treat anyone who shows up at an emergency room, whether they have insurance or not. The Centers for Medicare and Medicaid Services track any violations to that federal law. Neither Banner nor Dignity have any violations of that kind. But what about the heat? Are there any requirements that exist? Because Phoenix is kind of its own special case. I mean, we have some of the most extreme summers out there. Is there any requirement out there for extreme heat?
And the simple answer to that is no. Ryan says that in his mind, this is a shortcoming in the law. He said, you have to keep in mind, heat to us is cold in other states. And, when this legislation was put into law, they did not take weather into account. So while it's wonderful that there are certain precautions in place, you've got social workers trying to connect people with resources. You've got them not turning anyone away who doesn't have insurance or might be underinsured, and they do get this medical exam before they're discharged. But this is really sort of a shortcoming of the existing law the way it stands.
Well, and you look at when this law was dating back to 1986, our summers were, we didn't have the long stretches of heat like we do now, and it seems like a consistent record-breaking heat. almost every summer here in Phoenix. So it's a new kind of extreme, and some areas of the country also experience that on the flip side with harsh winters. So you wonder if it's something that should be re-examined given the extreme climate on both ends of the extreme summers and winters that the country is seeing. But it also presents a new danger, especially here in Phoenix, because we've covered cases where people just simply, they're not even a hospital patient, but they're out walking and trip and fall in the extreme heat and land on the sidewalk, and within a few minutes you are left with severe burns. So, it's not a extreme amount of time before the heat turns dangerous here in Phoenix. And so, if they weren't incredibly well, or if they had some underlying health condition that were to cause them to collapse outside the hospital, then they end up on that sidewalk and they could have a burn risk there.
It's true. But in speaking to another attorney, they pointed out sort of the flip side to this, which is that emergency rooms are often overcrowded. And if they just let people stay in the hospital all day long, it just wouldn't work. And we do have those cooling centers in Phoenix, which we know there are some issues there that we've reported on, where they're not always publicized the way they should be. They're not always open in some of the hottest parts of the day. So there are issues there, but they are trying to create resources for folks that have nowhere to go.
It almost brings up the question, since these are at, bus stops, is this something where, Valley Metro steps up and, offers increased frequency to these cooling centers during the times that they are open and have extended hours, because that is such a lifeline. But this isn't just in Phoenix. We've seen this across the country, and it's not just a one-off problem here.
Yeah, and we should also point out that mental health is also a real issue here. Dennis Plunkett had also pointed out he works with some people that have behavioral health issues. And so he admits that that is an issue too, and we don't have enough hospital beds or beds in these mental health facilities either. So there's a lot of issues at play here, and it doesn't appear that any city has got the answer just yet.
And we've also seen it with the stories that we've done on the unhoused population here in Phoenix. The city and these organizations offer help and have these set of services that they can offer to people, but some people just won't accept the help. And so they have to, overcome that as well.
It's true. And it's interesting here because we've done so many stories about affordable housing and how there's not enough of it. But then when communities go to build affordable houses, there's also neighbors who don't want the affordable housing in their backyard. So that is also an issue in here.
Yeah, it's definitely something that gets people thinking about, what needs to happen, because these are facilities that are there to help, but definitely, none of these facilities want to release people out to vulnerability. So they want to see them, be healthy and go about and live healthy lives. So none of them want to see this happen, but it's just, what is the solution? That remains to be seen.
Right. And we should point out, too, that there are a lot of mitigating factors. Some folks in these populations are not getting the medical treatment until it's an emergency. They're not getting regular checkups. And so some of these conditions can sort of linger and lead to more serious conditions. And then the heat can certainly make those conditions worse.
Exactly. Well, that's it for this edition of the Arizona's Family Investigates podcast. To watch this full story, you can head over to our website or AZ Family News app, or on any streaming device. You can click on the Investigates tab and watch it there. For Amy Cutler, I'm Cody Lillich. Thanks for joining us.
The Arizona's Family Investigates podcast, hosted by Amy Cutler and produced by Cody Lillich, and a production of Arizona's Family 3 TV, CBS 5, and azfamily.com in Phoenix, Arizona.